spinal cord, inside of the vertebral column. I told you, nerves start from spinal cord and brain. When start from brain, we say cranial nerve, 12 nerve. When start from spinal cord, we say spinal nerves. We have 31 spinal nerves, 31 pair, right and left. Pair. 31. I told you they have 5 regions. Cervical region in the neck, this nerve, C. How many C? Cervical region, C1 to C8. 8 nerve in the neck. T, thoracic region, here, chest. How many? Lumbar region, here in the back. 5. L1 to L5. Sacral region, in the sacral. 5. And finally, one nerve is coccygeal, going out from coccyx. So look at here, 8, 12, 5, 5, 1, 31 nerves. Okay. I told you, for example, brachial plexus start from which nerves created brachial plexus? You did the exam and forgot everything, yes?
5, 6, 7, and 8, and T1.
C5, C6, C7, C8, and T1. 5 nerves making the brachial plexus. Lumbar plexus, we have 4 nerves. L1, L2, L3, L4. So if I ask you which nerves participate in the lumbar plexus, you say L1 to L4. Lumbar nerve, L1, L2, L3, L4, not L5. L5 goes to the sacral plexus. Okay? L1, L2, L3, L4. So in brachial plexus we had superior trunk, middle trunk, inferior trunk, divisions, cords, a lot of structures. No, here we don't have anything. Just we have nerves, then each nerve divides to the anterior and posterior branch. Each nerve. Anterior branch, you can say ventral branch. Ventral. Ventral means bat knee. Posterior branch, you can say dorsal branch. Just these divisions. So L1, L2, L3, L4. Then each nerve divided to the 2 branches, and now we can talking about how many nerves start from this plexus, lumbar plexus. We have 6 nerves. 6 nerves start from this plexus. Look at here. This is lumbar plexus. L1, L2, L3, L4. Okay. L5 go to the sacral plexus. So what are the nerves? Iliohypogastric, ilioinguinal, genitofemoral, lateral cutaneous nerve of the thigh, femoral obturator. These 6 nerves start from lumbar plexus, and they are responsible for anterior side, medial side, this region of the thigh. Look at the names. Iliohypogastric. What you can understand from this nerve? Iliohypogastric. Hypogastric means under stomach. Hypogastric, no. Hepatitis means liver. Hypo means below. Hyper means high. Hyper. Opposite of each other. Gastric means stomach. Hypogastric means here, this region. Hypogastric means ileum and inferior side of the stomach. Ilioinguinal. What you can understand from this nerve, this name. Ilium, hip bone, iliac crest. Okay. Ilioinguinal. What is inguinal? No. Artery, no. Nerves, no. Vein, no.
Bone.
No. Inguinal. No.
Below the ribs.
No. Inguinal ligament. Inguinal ligament is robot, yes. Where is the look? I told you, previous session.
Yes.
Inguinal ligament. We have one important ligament between ossis and pubic tubercle here. We have a ligament between ossis, anterior, superior iliac spine, and pubic tubercle. This is inguinal ligament. And I told you this ligament is border between abdomen and lower limb. Is a line between abdomen and lower limb. This ligament, inguinal ligament. We have a canal here, inguinal canal. You will study them in the trunk, okay, in the third semester when you read the digestive system. So this region, ilioinguinal, it means this nerve going to this region, inguinal canal. Genitofemoral.
One for genital and one for female.
What is genitalia?
Genital and female.
Genital system, yes, means tanasuli, okay? Sexual system, yes. So this nerve, genitofemoral, both goes to the genital system and femoral region because they are close together. Lateral cutaneous nerve of the thigh, so goes to the lateral side of the thigh, in the skin. Lateral cutaneous, the skin.
Why color green?
I will tell you. Just show you this nerve. Just highlight it. Because it's completely sensory. Femoral. I will explain that. And obturator. Look at the
Obturator foramen.
obturator foramen. Very good. In the hip bone, I told you we have one foramen. Obturator foramen. This nerve passing from this foramen. Obturator foramen. L1, it has two nerves. Iliohypogastric and ilioinguinal. So L1, you should know this. L1, two nerves. Iliohypogastric, ilioinguinal. T12 also help the L1. Look at here, help that. But we say L1. Iliohypogastric, ilioinguinal, okay? Genitofemoral, L1, L2. Genitofemoral, L1, L2, okay? You should know the roots. Femoral and obturator are same. Femoral and obturator are same. L2, L3, L4. L2, L3, L4, posterior branch are femoral, anterior branch are obturator. Anterior branches of L2, L3, L4, ventral branches. Obturator, posterior branches are femoral, L2, L3, L4, both obturator and femoral. This one anterior branches, this one posterior. Lateral cutaneous, L2, L3, posterior branch of L2, L3. So these are 6 nerves we have, and you can read all of them. Obturator, L2, L3, L4, genitofemoral, L1, L2, femoral, posterior division of L2, L3, L4, lateral cutaneous, L2, L3. Sometimes we have one accessory nerve. Accessory means not main. It's not main structure, accessory, it's here. This nerve, look at here.
This one.
Yes. Accessory obturator. Sometimes we have this nerve from L3 and L4. It's not main obturator. Main obturator is this nerve, L2, L3, L4. This is a small one. Sometimes we can see accessory obturator from L3, L4. Goes to the muscle in the pelvis, not to the lower limb. Yes. This picture is important. Which muscles, they have sensory function, which nerves, they have sensory function in the thigh. Yes, we have 6 nerves. Look at the picture. Ilioinguinal, yes, I told you. Because one nerve going to the inguinal canal, it's here. So it has function in the thigh. Ilioinguinal. Look at here, this nerve. So ilioinguinal is sensory for the upper part of the thigh, this region. Okay, ilioinguinal L1. Femoral branch of genitofemoral. Look at the name of the nerve. L1, L2. Genitofemoral. Genital system. Femur, thigh. It has two branches. One femoral branch for the femur, one genital branch for the genital system. Okay? So, we had one question, which nerve is not sensory for the thigh? Genital branch of the genitofemoral. It goes to the genital system. Femoral branch goes to the thigh. So femoral branch of the genitofemoral. It's here. It should be here, yes. Femoral branch of the genitofemoral. Second nerve, sensory. Lateral cutaneous nerve of the thigh. Yes, we had it. L2, L3. Lateral cutaneous nerve of the thigh. It's here. So now we talked about three nerves. Ilioinguinal, femoral branch of genitofemoral, and lateral cutaneous nerve of the thigh. We have other three nerves. Obturator and two branch of femoral nerve. So this one obturator nerve. Obturator nerve, yes, L2, L3, L4, passing from the obturator foramen. Obturator nerve is responsible for medial compartment. So medial compartment of the thigh, the nerve is obturator, adductor muscles. Obturator nerve. We had one question. Which nerve is responsible for the medial compartment of the thigh? Obturator. How about anterior compartment? Femoral. So two important nerves for controlling muscles. Anterior compartment, femoral nerve. Medial compartment, obturator.
Why not we start in the bone?
Why don't we?
We start in the study bone, nerve from the muscle.
So because the bones is bones, first of all we're talking about the skeleton, the bones, then we start soft tissue. We're talking about muscles, artery, nerve.
We don't have study soft tissue today.
No, we start now.
Soft tissue.
Yes, this is soft tissue, nerves, artery, muscle. So, obturator nerve is responsible for medial compartment, both motor and sensory. So this region, sense of this region also for obturator nerve, medial side of the thigh. And these three nerves, all of them branch of femoral nerve. Femoral nerve, yes. The main nerve for anterior compartments is femoral nerve. It has motor function, sensory function. Motor function for muscle here. Sensory function, it has three nerves. Intermediate cutaneous, medial cutaneous, and saphenous. So, what happens now? We had one nerve, lateral cutaneous nerve of the thigh, a specific nerve, lateral side of the thigh. Now, we have one branch here, anterior cutaneous, intermediate cutaneous, here, and one medial cutaneous. Okay? So, intermediate cutaneous and medial cutaneous are the branch of femoral nerve. Intermediate cutaneous and medial cutaneous in the tongue. And finally, look at the intermediate cutaneous. Look at the medial cutaneous. It's here. Where is medial? It's here. Okay. And finally, saphenous. Saphenous is a sensory nerve from femoral nerve for medial side of the leg. Medial side of the knee and medial side of the leg. For this reason, I can see that in the medial side of the knee. So saphenous also is a sensory nerve, medial side of the knee and medial side of the leg. So I can see saphenous nerve here.
It also divides from
Femoral, posterior division of the femoral nerve. We had one question. Saphenous nerve, start from femoral nerve, posterior division. I will talk about that. So all of these picture are sensory. 6, 7 nerves. Look at here again. Femoral branch of the genitofemoral, ilioinguinal, lateral cutaneous nerve of the thigh, intermediate cutaneous and medial cutaneous nerve of the thigh. These two branch of the femoral nerve. Saphenous nerve is a branch of femoral nerve, and most medial part, obturator nerve. These 7 sensory nerves in the thigh. So this region is very rich from the sensory nerves. You have 7. Also, upper part, gluteal region. We have ilohypogastric, but we don't consider in the thigh it's a gluteal region. So,
Obturator nerve is responsible for motor compartment.
yes, both motor and sensory.
Who is responsible for lateral compartment?
No, we don't have lateral compartment. Anterior, posterior, medial. If you ask posterior, it's correct. I told you, again, anterior compartment of the thigh, femoral nerve, and its branches. Medial compartment, obturator nerve, motor and sensory function. Posterior compartment, what is the nerve? From sacral plexus, not lumbar plexus. Posterior side of the thigh and leg, you have sacral plexus. And the most important nerve, sciatic nerve. Sciatic nerve. It's for sacral plexus. Next session. Look at this picture I told you. Look at the saphenous. Saphenous nerve. Medial side of the knee, medial side of the leg. We have one plexus network, shabakeh, around the patella. Around the patella, patellar plexus. 4 nerves attached together. Lateral cutaneous, intermediate cutaneous, medial cutaneous, saphenous. These 4 nerves here attached together. Patella, around the patella, so patellar plexus. Anterior, intermediate, lateral, intermediate, medial, and saphenous nerve. These 4 nerves, they are participating in the patellar plexus.
Also, nerve.
No, obturator nerve don't participate here in the patellar plexus. Obturator nerve just in the medial part. Look at here, obturator just here. It's not related to the patellar region. Patellar region, we have these 4 nerves. There, 1, 2, 3, 4. Okay? Obturator is here.
And this is cutaneous plexus.
Yes, cutaneous plexus, sensory plexus. Fasciolata. Fasciolata. Deep fascia. In most region of the body, deep fascia has a name. I told you, layer of the body. First layer is skin. Second layer, superficial fascia. After superficial fascia, deep fascia. Deep fascia in the body, always they have name, instead of upper limb. We don't talk about the name of the deep fascia, we just, I told you, deep fascia around the muscle. So here, in the lower limb, it has a name. Fascia lata. Look at this picture. Look like a socks. Jurab, yes? It's here. This says deep fascia, around the muscle. 1 layer, around all of the muscle. Deep fascia. But in the thigh, we say fascia lata. In this region, this is popliteal region. Popliteal fossa, this place. Cubital fossa, popliteal fossa. We say popliteal fascia. In the leg, we say crural fascia. It's 1 layer, but in each place it has a specific name. So when we say fascia lata, it means here, deep fascia of the thigh. Deep fascia of the thigh is fascia lata. Okay? So, look at the attachment of this fascia, superiorly. superiorly attached to the inguinal ligament. This ligament. This is inguinal ligaments, I told you. Between abdomen and lower limb. Inguinal ligaments. Attached to the iliac crest, attached to the pubis, pubis ramus, attached to the sacrum, all around the upper limb, fasciolata. Inferiorly, attached to the tibia, attached to the patella, attached to this region, fasciolata. Look at this vein. Look at this vein. What you can understand from this vein, this picture.
It starts from posterior compartment, then goes anterior, and from
Like
Yes, like cephalic vein. They are superficial vein. Why superficial? Because they are superficial to the deep fascia. So they are located in superficial fascia. If you can't see this vein, it means this is deep vein. Deep, inside of the deep fascia. Look at the vein here, deep vein. But look at this vein, it's superficial. Superficial. So this is superficial vein of the lower limb. In the upper limb, you have two veins. Cephalic vein, basilar vein. In the lower limb, great saphenous vein. Great saphenous vein. I start from dorsal side of the foot, goes up from medial side of the leg, medial side of the thigh, finish in the deep vein.
so all is fucking all
Saphenous vein, great saphenous vein. We have another small vein, I will tell you in the leg. We have one small vein here. But the most important one is great saphenous vein, superficial vein. So look at the fasciolata. It has two important parts. First of all, iliotibial tract. Iliotibial tract. What is the meaning of tract? Tract means something like vein. Vein. Okay? Iliotibial tract. What is this? A sickness. Sickness in the fasciolata. Where is it? Lateral side of the fasciolata. Look at this picture. This sickness, Zachim, in the lateral side of the fasciolata, it has a name. Iliotibial tract. Fasciolata is sickened, 5 centimeter wide. Okay? Iliotibial tract. Look at the name. Iliotibial. Start from iliac crest, attached to the tibia, condyle of the tibia. Iliotibial tract. What is the function? What is the function of this tract? Attached to the lateral side of the tibia. Very good. Control the knee joint. Stabilize the knee joint in both flexion and extension. This is very important. If you extend your knee by pressure, you can feel here a sickness in the lateral side of the thigh. This is iliotibial tract. Two muscles attached to this tract. Two muscles attached to these tracts.
Gluteus maximus and tensor fascialis.
Very good. What is your name?
Omar Ali.
Clap for him. Very good, yes. Two muscles attached to this tract. Gluteus maximus and tensor fascialis. Look at here. What is the meaning of tensor? Tensor fascialis. Fascialis is fascialis. What is the meaning of tensor? Sensor? No. Tensor, we have this term. We have this term in different muscles. Tensor vini palatini, tensor tympanic, tensor fascialis. Tensor means pulling, pulls, not push, pulls, okay?
Flex.
Yes. This muscle, tensor fasciolata. Pulls fasciolata. It's here. Pulls the fasciolata, tensor fasciolata. So they can help the walking, the flexion and extension of the knee and stabilize the knee joint. It's a part of fasciolata, iliotibial tract. You have one foramen in the fasciolata. I can see one foramen in the fasciolata. What is the name of foramen? Saphenous foramen. Why saphenous? Because great saphenous vein, superficial vein, passing from this foramen and attached to the deep vein. So that superficial vein here goes up and finally attached to the deep vein. So we need one foramen. This superficial vein goes deep. So the name of this foramen is saphenous foramen. Where is the location of this foramen? If you find pubic tubercle, it's inferior and lateral, 4 centimeter. Inferior, 4 centimeter, lateral. Saphenous foramen. Lateral side of this foramen is very sharp, and we call it falciform region. Falciform region. Falciform is named, you have it in different place. Form again means shape. Falsi means in English I think we call it sickle. It's yes. This shape. For example, you go to the you grow some plants, you cut them like this. What do you say? Falciform means this. Look like this. Falsi means this. Falciform. Because it has this shape. Okay? Falciform. How many compartments we had? 3 compartments. Look at this picture. Anterior compartment, posterior compartment, medial compartment. And one bone we can see in the thigh, femur. So now we find the intermuscular septums again. We have 3 intermuscular septum. One lateral intermuscular septum. One medial intermuscular septum. And another one posterior. So these are 3 intermuscular septum. Lateral, medial, posterior. Between these compartments. All of these septums start from deep fascia. This is deep fascia. And attached to the femur. Which part of the femur? Posterior border. Linea aspera. It has 2 lips, lateral lip, medial lip. These septums attached to the posterior border, as you can see in this picture. So these are 3 intermuscular septums between 3 compartments. Femoral triangle. Femoral triangle. In the femur, in the thigh, we have important rule. We have an important rule. Pay attention to this. If we divide the thigh to 3 1/3, upper 1/3, middle 1/3, and inferior 1/3. In each region, we have one important point. In upper 1/3, I can see a triangle. Femoral triangle. So upper 1/3 of the thigh, you can see a triangle, femoral triangle. In middle 1/3, you can see a canal. Here we have a canal. Between muscles, we have channel or canal here. Yes, a structure passing from here. Femoral canals or subsartorial, hunter, it has different names, canals. Lower one-third goes to the back, here. Popliteal fossa. Popliteal fossa. So again, if we divide the thigh to the three places, upper one-third, middle one-third, and lower one-third, we can see a specific structure. Upper one-third we have triangle, middle one-third we have channel, lower one-third we have popliteal fossa. Now we're talking about femoral triangle. In the femoral triangle, first of all, you should know the borders, boundaries. Base, apex, yes. This is apex here, grass. This is base. What is the base? Inguinal ligament again. So this ligament is very important. Inguinal ligament, this ligament. Between ossis and pubic tubercle. Inguinal ligament. Base of the triangle. Lateral borders. We have one muscle. Lateral border. We have this long muscle. This muscle is sartorius. Sartorius. Sartorius muscle. In Farsi we say khayate. Yes, it's a job. Khayat, yes? The name of this muscle is khayate. Yes, making clothes. Why this name? In bodybuilder person, you can see a long muscle here. From up lateral goes to the down medial. This is sartorius. Look at this muscle. Sartorius means chayote. Why we call this name? Because in the past, this person, when they fixing the clothes, they sitting something like this, okay? And this muscle was very obvious, okay? Chayote. So, sartorius is the lateral side of the triangle. Medial side of the triangle, we have another muscle in adductor longus, in adductor group. We will talk about muscle, adductor longus. So this is the triangle. Again, base, inguinal ligament, lateral side, sartorius muscle, medial side, adductor longus. What is the content of this triangle? Most important structure in anterior side. Look at the contents. Look at here. We have three important and big contents. From lateral to medial. Femoral nerve. Femoral artery. Femoral vein. So these three structures are located in the femoral triangle. Femoral nerve, femoral artery, femoral vein. We had one question, what is the lateral structure in femoral triangle? Femoral nerve. Femoral nerve, where is the origin? Lumbar plexus, L2, L3, L4, coming to the anterior compartment, I told you. Femoral nerve is important for anterior compartment. Femoral artery, yes, I will tell you where is the origin, and femoral vein. So, femoral nerve, femoral artery and its branches, femoral vein, and I can see this branch, femoral branch of the genitofemoral nerve. I told you, genitofemoral has one femoral branch, one genital branch. So femoral branch is here, in the femoral triangle.
Movements with the femoral artery. Femoral branch of genitofemoral.
It's sensory, it's not motor. Goes to the skin. It's sensory, femoral branch. Look at here, supplies the skin. So it's sensory, not motor.
Movement femoral artery.
Yes, femoral branch of the genitofemoral nerve is anterior to the femoral artery. Anterior to the femoral artery. And some inguinal lymph nodes. This region, femoral triangle, is important region for lymphatic system, lymph nodes again. Like axilla. Here we have some superficial lymph nodes, some deep lymph nodes. They are located here. Deep inguinal lymph nodes.
What's the origin of femoral artery?
What is the origin of femoral artery? Who can tell that? Origin of the femoral artery.
External iliac artery.
Very good. External iliac artery. What is external iliac artery? So look at it. The biggest artery in the body, aorta. The biggest artery in the body, aorta. Start from the heart, goes up, ascending aorta. Then turn to the left, aortic arch. Then subclavian, common carotid for uppercut. Then descending aorta. Descending aorta in the chest, descending aorta in the abdomen. This is aorta. Finally, aorta finish at the L4 level. L4. Lumbar region, L4. Okay? Finish here. No. If we consider the vertebral column, lumbar region L4, L1, L2, L3, L4 here. Look at here. Aorta finish by dividing to the two branches. Yes, these are common iliac. Common iliac right, common iliac left. So aorta divides to the two branch. Common iliac. Common means mushtarak. Common iliac right, common iliac left. Then common iliac divides to the two branch. Internal iliac, external iliac. Internal iliac for inside of the hip, inside of the pelvis, internal iliac. External iliac goes to the lower limb. External iliac goes to the lower limb. So look at here. Aorta, common iliac, internal iliac, external iliac goes to the lower limb. After passing from the inguinal ligaments, external iliac, the name changed to the femoral. The name of the external iliac artery changed to the femoral artery. After passing from inguinal ligament. Look at the picture. This is inguinal ligaments. And external iliac changed to the femoral artery.
Femoral artery is supplied the anterior artery.
Yes, all of them. This is the main vessel for the lower limb, all part of the lower limb. Here in the thigh, we say femoral artery. When goes to the popliteal region, we say popliteal artery. Then it's same here,
Like
brachial artery. Then divide to the tibial artery.
I think we have a question for external iliac artery.
Yes, it's here. So, femoral triangle contents femoral sheaths. Sheaths means malaf, yes. They have a sheaths, malaf, around the vessels, artery and vein. Look at here. This is femoral sheaths, this white color, around the femoral artery and femoral vein. Usually in some part of the body, vessels, they have sheaths. In the axilla, in the thigh, in some regions, they have sheaths, femoral sheaths. But femoral artery, femoral vein, and I can see some lymph nodes here in the femoral sheaths. So we have three structures in the femoral sheaths. Lateral side of the femoral sheaths, femoral artery. Middle part of the femoral sheath, femoral vein. And medial side, you can see femoral canals. Femoral canals for the, for the lymph nodes, yes. We had one question. Which structure is located in the middle part of the femoral sheaths? Femoral vein. It's different with femoral triangle. In femoral triangle, I told you, femoral nerve, artery, vein. In femoral sheaths, we don't have nerve, because nerve is here, outside of the sheaths. We have artery, vein, and lymph nodes. Femoral sheaths. Yes. I told you in the femoral triangle we have three structures: femoral nerve, artery, and femoral vein. Femoral artery and vein, they are inside of the sheets below, not nerve. Nerve is outside. This sheet is femoral sheet. Besides of the femoral artery, vein, you can see some lymph nodes medial side of the sheets. So these sheets below, it has three structures: femoral artery, femoral vein, and femoral canal for lymph nodes. Okay?
Artery, lateral side of the sheet.
Yes, medial side is vein, medial side is the lymph nodes. This is the sheets. Femoral hernia. What is the meaning of hernia? What is the meaning of hernia in Arabic? Fatah, yes? Fatah. Hernia means this. So what is the fatah, hernia? When some part of the abdomen, intestine, by pressure they going to the other place. For example, umbilical hernia, it's here in this foramen. Inguinal hernia in the inguinal canal. Femoral hernia in the femoral canal. So this canal, okay? Femoral canal here. When some part of the intestine going to this canal, this is hernia. The person feel a lot of pain. It has a lot of pain. When working, when making pressure in the abdomen, you feel pain. So he needs surgery to remove the intestine from the foramen and close the foramen. Femoral hernia is very common in the female. Why? Because the arm vessels are small. In the females, the vessels are smaller, so the canal is bigger. And the hip region in the female is wider. So for these two reasons, femoral hernia is usually happens in the female. But inguinal hernia, this hernia, is common in the male. You will study in the next session, yes?
Usually hernia.
Yes, umbilical hernia. This region is umbilicus or hilus. When we have, it has a hernia. No, the usual hernia is inguinal.
Most common.
Yes, inguinal. And final point for today, femoral artery. After that, you should study the muscles by yourself. I explain next session, and also read the posterior compartment. So finish the lecture and read the posterior compartment, the gluteal region. I put the lectures in the LMS. Final point, branches of the femoral artery. Branches of the femoral artery. Femoral artery has 6 branches. 3 branches are superficial, 3 branches are deep. Okay? 3 superficial, 3 deeps. We start with superficial branches. Look at the name. All of them, they have superficial. Superficial, superficial, superficial. Superficial external pudendal. Superficial, okay. External, khariji, outside, okay. Pudendal is genital system. Pudendal. So this branch goes to the genital system for superficial region. Superficial, external, pudendal. Next, superficial epigastric. Again, hypogastric, epigastric. This branch goes up for a stomach. It's superficial for a skin. Superficial epigastric. Superficial circumflex iliac. Circumflex, turning. Circumflex iliac, turning around the ilium, iliac crest. Superficial, external iliac. Yes, so these are 3 superficial branches. Superficial external pudendal, superficial epigastric, and superficial circumflex iliac. These three branches start from the first part of the femoral artery. Look at here. First of all, here, we have these three branches: superficial circumflex iliac, superficial external pudendal, superficial epigastric. First of all, after passing from inguinal ligament, you have these three superficial branches. Okay. Superficial means goes to the superficial fascia. Three deep branches. Again, profunda. Profunda femoris. Here we had profunda brachii. Here we have profunda femoris. Muscular branches for muscles. Okay.
So what supplies?
I will tell you. And deep external pudendal. So these three branches are deep. Again, deep external pudendal for genital system, external side, but it's deep. Muscular branch for muscles. Okay. And most important one, profunda femoris. Is it same to the profunda brachii? Look at it. Profunda femoris, it has some differences with profunda brachii. What is one of them? Profunda femoris not going to the posterior compartment. It's again in anterior compartment. Pay attention. Femoral artery is here. Anterior compartment, then goes to the sartorial canal, and then goes to the popliteal fossa. This is femoral artery. In the femoral triangle, in the hunter canal, then goes to the popliteal fossa, femoral artery. Look at the profunda femoris. This branch is profunda femoris. Profunda femoris. So profunda femoris is still in anterior compartment, not going to the posterior compartment. In the arm, I told you, profunda brachii goes to the posterior compartment. Here, it's completely in posterior compartment. But here, profunda femoris stay in anterior compartment. So the question, what is the blood supply for the posterior compartment? Profunda femoris is anterior side. It has branches for posterior compartment. Look at here. For posterior compartment. Look at here. Again. This is femoral artery. Goes down. Okay. This is profunda femoris. Okay. All of these two arteries, they are in anterior compartments. So which vessel goes to the posterior compartment? Branch of the profunda femoris. It has three branches for posterior compartment. We call it perforating branches. Perforating branches. Perforating means penetrating. They penetrate and goes to the posterior side. Where is it? Here. First perforating, second perforating, third perforating. And finally, the artery goes to the posterior side. Profunda femoris. Finally, the lower part goes to the posterior part. Terminal part of the profunda femoris. So the blood for the posterior compartment is perforating branches from profunda femoris.
4 branches?
And finally, the artery goes to the posterior side. This is the fourth branch, lower part of the profunda femoris. Okay? We can say the fourth perforating
It is
branch.
large.
Yes.
Branch from
So look at the branches from profunda femoris. It has 4 perforating arteries, 3 branches, and the number 4 itself goes to the posterior compartment. And these 2 important branches, circumflex femoral, like circumflex humeral, anterior circumflex humeral, posterior circumflex humeral. Here we say lateral circumflex femoral and medial circumflex femoral. Lateral circumflex femoral and medial circumflex femoral. They are not from femoral artery. They are started from profunda femoris. Okay, so circumflex femoral artery, lateral, medial. They start from profunda femoris. So what is the branches from profunda femoris? It has perforating branches and circumflex femoral, lateral and medial. Femoral vein is the medial side of the artery and receive the superficial vein. Let's read the remaining slides, 10 slides, and muscles. And also for next session, read the gluteal region and posterior compartment of the thigh. Now the first group comes